Good morning. Good morning and welcome. We are going to be getting started in about 2 minutes. If you can make sure that you have coffee, drinks, and have found a seat, we will be starting here at 10:02.
Good morning. I'm Undersecretary of Education James Quall, and I have the honor of welcoming you to the latest iteration of the department's Raise the Bar Summits. Today, we're focused on securing the mental health of America's college students, and this is an important one. The Surgeon General, Dr. Vivek Murthy, has warned us that social disconnectedness is now a national epidemic, and young adults are almost twice as likely to report feeling lonely as adults over the age of 65. When I meet with college students, I'm struck by how often they bring up the mental health challenges they face. Students have told me about their anxiety over their grades and their futures, their loneliness, and the lack of connections and close friendships. I'm struck by their bravery because when I was their age, I wouldn't have admitted those challenges to myself, much less a middle-aged guy in a suit from Washington, D.C. And I think all of us who are in a position to help have a responsibility to listen to their voices. From the burdens of academic performance to the growing dominance of social media in our personal relationships, our students navigate a minefield of stressors that can take a toll on their mental health. These problems began before the COVID-19 pandemic, but the pandemic surely worsened them. The sudden shift to remote learning, the isolation from campus communities, and the collective trauma of a global crisis have left indelible marks on the mental health of our students. We've witnessed a surge in anxiety, depression, and other mental health disorders, underscoring the urgent need for action. So today, we've gathered some of the national leaders who've recognized these needs on college campuses and taken the lead in addressing these mental health challenges. I want to applaud this work, and we have supported it through the American Rescue Plan's Higher Education Emergency Relief Funds. And so, I'm sorry I cannot be with you personally this morning, but please know that I and the Secretary and everyone here at the department is committed to making today the start of something. Let's resolve to redouble our efforts to support the success of all students, including students overcoming mental health challenges. Today, we have an opportunity to chart a path that prioritizes the mental health and well-being of our students so that every student has the support they need to thrive. And to work toward a vision that encompasses a holistic approach to mental health that combines prevention, early intervention, and comprehensive care. We need to recognize the importance of destigmatizing mental health challenges and fostering a culture of openness and support. We should leverage the power of technology to expand access to mental health resources and services to reach students wherever they may be. But above all, we need an approach that is grounded in empathy and compassion, and that recognizes behind every statistic there is a story of struggle, resilience, and hope. It calls upon us to listen, to empathize, and to act with purpose and determination. So as we embark on this journey together, let's reaffirm our commitment to the well-being of all of our students. Let's forge new partnerships, share best practices, and work toward meaningful change. And let us never lose sight of the profound impact that we can together have on the lives of those we serve. Thank you for your dedication, your passion, and your commitment to this important cause. With that, I'm honored to turn it over to my colleague and friend, Roberto Rodriguez. Roberto is the Assistant Secretary for Planning, Evaluation, and Policy Development. He is a leader on mental health issues. And not only is he an insightful and accomplished policy expert, but one of the kindest and most generous people I know. Thank you, Roberto.
Well, thank you and good morning. It is wonderful to see you all here today and a great pleasure to welcome you this morning. We have such an impressive room of change makers and leaders here with us today, and others joining us virtually. Each of you are invited here because you are making a contribution to this challenge, and you are committed to helping to turn the corner on this challenge of mental health in higher education. So I want to thank you first and foremost for taking time to be with us here today. I know what an ask it is to take time away from your regular commitments. Those of you who've joined from your campuses, thank you for making time to be here, especially those of you here in person. I'd like to extend a thanks to our gracious hosts, Johns Hopkins University, for this great space to come together today. I want to thank IHEP for their collaboration today as well. And I want to express my great gratitude for just such outstanding colleagues, our Undersecretary James Quall, our Assistant Secretary Nasser Pater, who's here with us today too. Our administration's agenda for post-secondary education is in such capable and experienced hands with Dr. Pater and with Undersecretary Quall. And it has been really highlight of my service in the Biden-Harris administration to work so closely with them to shape our policy proposals, to bring forth President Biden and Secretary Cardona's commitment and vision to raise the bar on college access, affordability, and completion. And I especially appreciate their commitment and partnership in focusing on today's agenda on securing the mental health of our college students. We've had the opportunity to visit campuses together. I know Nasser and I have had the chance to hear directly from our higher education presidents about how important this issue is. And so I want to thank you all for the chance to come together, galvanize a commitment to continuing to take action, making this a first step toward that end. And then finally, before we kick things off, I just want to extend a special acknowledgement to our own Jessica Bowen Gall, who is a policy advisor in my office, and she's been a principal architect with a lot of other talented policy staff in our team in bringing today's agenda forward. So thank you, Jess. So I don't have to remind this room of what a critical issue mental health is for our young adults on college campuses. Since experiencing the effect of the pandemic, isolation, social and emotional challenges, economic challenges, but even prior to the pandemic, mental health needs have been on the rise on our college campuses for the last 2 decades. We know rates of anxiety and depression are up among college students. 41% of our college students report experiencing major or moderate depression. 34% of our students report experiencing some amount of anxiety. Updated reports found that 44% of our students report experiencing depression. A lot of that loneliness and isolation that our Undersecretary just alluded to. Over 70% of our college presidents indicate that student mental health is one of their top 3 concerns. And faculty and staff mental health closely follow. And 87% of counseling center directors report an increase in need for mental health services on campus. More than half of our counseling centers manage that demand by referring students off campus or by triaging based on perceived urgency. And notably, our community college, first-generation students, low-income students, and our students of color continue to have high needs and high levels of unmet mental health needs. So we know that the research indicates that unmet mental health needs for college students are directly linked with adverse student outcomes, including a lower GPA, increased likelihood of dropping out. So it stands to reason that our students will be less able to access learning, less equipped to persist and thrive and continue on that journey to earn their degree if we're not more intentional and more focused on creating the conditions that enable them to feel safe, to feel supported, to be healthy, both academically and non-academically. So in the Biden-Harris administration, we've put such a high focus on post-secondary access and success because we know that a college degree is still one of the strongest tools to break the cycle of poverty in our communities. It is the critical rung on the ladder of opportunity that defines not just our country, but our world, right? That's why American higher education remains one of the strongest exports abroad. But as we examine opportunity gaps and economic mobility in today's economy, shaped by new investments in clean energy, in infrastructure, in innovation and AI, we know that a post-secondary education is not just a nice to have for some, it is a must-have for all. So based on that premise, we can't afford as a nation not to deliver the supports that all students need to attain their higher education. Getting there is going to require us to fortify pathways for success for every student. It's going to require us to design our higher education system and the experience for our students differently. A design that's more responsive to the needs of our learners, that's more reflective of their assets and their experience that they bring to their learning and to their journey toward earning a degree. When 60% of our Black undergraduate students and nearly half of our Latino undergraduate students never make it to graduation day, our higher education system is not living up to its full potential. When young people's tuition and student loan bills are competing with rent and food and increased transportation costs, medical bills for our adult students, childcare needs, our higher education system isn't living up to its full potential. So we need policies and systems that are attuned to support those needs, are deliberate about supporting those needs. We need more student-centered higher education policies and systems, ones that aren't designed for a bygone era of the traditional student, because today's college student is more diverse, more likely to be older, more likely to be balancing work and home and their courses, maybe more likely to care for children or to have to care for family members, more likely to be the first in their families to go to college. And our students are contending with these very real non-academic barriers, all of which are stressors that can contribute to mental health. So it would be easy to let the urgency and the imperative of the moment that we're in weigh in on us as policymakers, as leaders on campuses and in our communities. As someone with a daughter entering college this fall, believe me, I get that. But we're here today because we believe in what's possible, because we're committed to action, and because we don't want to let this moment pass us by. We need to utilize this moment as an opportunity to spur us to do more to meet our students where they are. Our administration is consistently focused on promoting access to behavioral supports at both the K-12 and the post-secondary levels. We've believed in that as an integral strategy to supporting the overall student well-being and success. Since taking office, we've sought to partner actively to leverage investments like HERF and GEAR to support students and to address behavioral needs. I want to thank many of you who've put those dollars into action in your systems and on your college campuses to support the behavioral health of your students. And just as the president has set forth a goal to double the number of school-based mental health professionals, and we've made great progress on that thanks to the Bipartisan Safer Communities Act, so too do we need to place an emphasis on a moonshot for higher education. What if we all work together to double down and to provide the comprehensive supports that every student needs to succeed? Mental health, food security, housing, transportation, childcare needs. What if we all work together to address the growing shortages of mental health professionals that are working to support our students on college campuses? Earlier this year, our administration issued a request for information to address some of these issues around mental health. We received over 150 responses. Many of you in the room and online responded to that RFI. The strategies and the practices that many of you outlined, the feedback that you provided has been incredibly helpful. It's clear that we need to continue to work together to grow the evidence base, It's clear we need to do more at the federal level to provide guidance and support and partnership to you in this endeavor. It's clear that greater funding and collaboration is needed to this end. It's also clear that our state and local leaders will ultimately be those responsible to turning the corner on this challenge. It's those of you in this room and those of you online that will be able to do that. I know we have the Secretary of Higher Education from New Jersey with us today, Dr. Bridges. I don't know if Dr. Bridges is in the room yet, but let me just mention, and he'll be moderating one of our breakout sessions later this afternoon. But I want to just highlight the proactive infrastructure actions that one state like New Jersey's taken, right? They've allocated $16 million of their ARP funds to their institutions of higher education to increase the capacity for meeting mental health support needs. They've partnered with community-based organizations to make that a reality. They've used some of those funds to increase professional development, focus on multicultural competencies around mental health, create greater access to a telehealth platform, and the state legislature has followed suit with Dr. Bridges' leadership and passed laws to require institutions to provide access to mental health care. That's just one example. There are many examples I know in this room, and I'm looking forward to making sure that we have an opportunity to share those throughout the course of the day. I want to highlight one of our budget proposals because the president's budget strongly matches and supports this imperative and this priority. And that's a $25 million comprehensive post-secondary student supports proposal that builds on the basic needs for post-secondary students program and centers mental health as a requirement to build better health and well-being on college campuses. We need your support and engagement as we try to pursue that and work with Congress to make that a reality. So, solving this post-secondary education mental health crisis can't be done by one person, one institution, one state or local leader alone. It is about an intentional collaboration to make this systemic change. I'm very excited with the opportunity to be a partner at the Department of Education with all of you in working to build knowledge, to provide greater resources to this end. We want to make sure that at your institutions, you're connected to the evidence base, you're connected to a community of peers that will help build the support for tackling the mental health challenge on our college campuses. And so now it's my pleasure to introduce you to Aaliyah Wong, who serves as an enterprise reporter at USA Today. We're really pleased to have Aaliyah with us today. She covers inequities in education, and she's formerly covered education for The Atlantic and the Honolulu Civil Beat. And we're very fortunate to have Aaliyah moderate our next discussion in our next panel from the great state of Texas, who will share more about their efforts to replicate and scale the positive results they're seeing in their system. Please join me in welcoming Aaliyah.
Good morning, everyone.
Good morning.
Is this better? Okay. Thank you, everyone, for being here. As the secretaries just outlined, campus mental health, and I firmly believe this as an education reporter who's been covering this topic for a dozen years. It is one of the most important issues facing higher education as a whole. It's clearly such a massive and complex and urgent problem that it really necessitates delving into some real world examples of what's working to learn from those examples. And so that's why we're zooming in on Texas. It's really been able to scale up supports for students in a sustainable way, and that is key, the sustainability. It's through a combination of these statewide efforts, specific campus level initiatives, and really kind of leveraging different funding, working with the legislature, gathering community resources, and again, collaboration has been really key. And so we're gonna hear from some leaders, some stakeholders about how all of that has worked, what the story has been. And so I'll introduce our panelists. You can read more about them online or in the event materials, so I'll just quickly introduce them. We have Kay Trent Pierce. She is a student at West Texas A&M University. And I was half joking that she's our most important panelist, no offense to others, because she's a student. And then we have Phil Ritter. He's the vice chair of the Board of Trustees at Dallas College. And last but not least, we have Gilberto Becerra. He's the Associate Vice Chancellor for Student Advocacy, Retention, and Completion at Alamo Colleges District. So my first few questions will be, you guys can tag team them. They're pretty general, and then we'll get into some specific questions that will merit your specific perspectives. So this first question is, let's start with, what is the Texas story, right? We know that this has been a story of the state being really intentional about improving campus mental health, and a story that has seen results. So how did it get there? What is this story? And I'm specifically interested in, what are some key changes that occurred to enable this story to be such a success? And anyone can chime in on that.
Well, I'll take a shot, I guess. Well, good morning, everybody. It's great to be with you. I'm Phil Ritter with Dallas College, and I just want to explain my limitations. I'm an elected trustee. I'm not a clinician. I'm not a professional. We have professionals like Dr. Carlos Cruz with Dallas College, who is here, who, like Gilberto, designs and actually runs these great programs. But the Texas story is an interesting one. And when we think about higher ed and mental health, it's really important to remember that it takes place in a larger context of healthcare. I mean, mental health is healthcare. It's a component of healthcare, and there's a whole lot of people who are involved in that. And if I was to say, when did this current Texas story around mental health begin, I'd go back to 2015. And back in 2015, the Texas Department of Health and Human Services went through Sunset Review, which happens to our state agencies every 10 years. And that was a real opportunity to dig into mental health. And the Sunset Review Commission did that. They asked the agencies of the state of Texas, how much are you spending on mental health? And nobody could really answer the question, how much in total was being spent. There are about 12 separate agencies of state government, including the Higher Education Coordinating Board and our higher ed institutions, as well as K-12, as well as HHSC, as well as the Workforce Board, that get involved in mental health. But there was no overall statewide coordination or strategic plan for mental health. This was all discovered in the Sunset process. And as a result, the legislature, which, by the way, there's been a very, very strong bipartisan consensus in the state of Texas around mental health over the past 10 years that has underpinned a lot of the change that has occurred there. But the legislature established and chartered the HHSC with administering a statewide mental health coordinating council, and also developing a biennial strategic plan for mental health, which includes all of the agencies that are involved in mental health, including educational agencies. So that was a key development in our journey in Texas. Following that, there were a couple things that happened in the next few legislative sessions. The legislature created a series of collaborative grant programs, and I understand DOE may be looking at perhaps something similar here. But the idea was, hey, mental health is so fragmented, it's so uncoordinated. How do we get stakeholders together to have a common planning and evaluation framework and coordinate resources and service? And so there was a series of collaborative matching grants that were set up at the state level, to which community organizations, higher ed institutions, philanthropic partners, nonprofit partners could all apply. And that has had a tremendous impact in the state of Texas, in a state as big as ours, in galvanizing local coalitions and local coordination of services in the state of Texas. State hospitals. You look at state hospitals in most states, where are they? They're in rural areas, Civil War era type things. Think of like One Flew Over the Cuckoo's Nest, right? Well, our legislature undertook a strategic state hospital redesign plan to really take hospitals out of rural areas in many instances and place them in urban areas where people live and can be closer to services, and where people who need to access those types of services can stay connected with their families, but also with their communities and with their educational institutions. That was another key development. Our Supreme Court and our Court of Criminal Appeals established a Texas Judicial Commission on mental health. And when you think about it, whether it's civil or criminal, a lot of folks who are involved with dealing with mental health issues are justice-involved individuals. Well, how does the justice system get smart on mental health and aware of what kind of community resources are out there? So that happened. There's been a lot of highly technical work, and this is very relevant for higher ed institutions in billing around the CHIP program, the Children's Health Program, and also Medicaid program. How do we create the ability, how do we structure our benefits in the state of Texas so that mental health services can be billed? And in many instances in Texas, higher education institutions are actually billing both Medicaid, CHIP, as well as commercial insurance. And then the last thing I would mention is, there's been a big focus on K-12 mental health and the creation of statewide telehealth networks, the creation of networks to leverage academic medical institutions to provide real-time consultation on mental health to primary care physicians and people who are working in primary care settings. Hundreds of millions of dollars has been put into the Texas Children's Mental Health Consortium for programs of that nature. Those are all assets that can be leveraged and that we intend to leverage on behalf of higher education in our community colleges and in our other four-year institutions. So that's a little bit of the context about what's been going on in Texas the past decade.
Really helpful overview. Anything to add, either of you? No need.
Well, I would just add from the organizational or institutional perspective, the journey for Alamo Colleges really started about 2015 as well, with a story about advocacy. And the story really started about what do we need to do to make sure that we're meeting student needs. And so that conversation really began with informal, locally developed instruments. And we started to hear students talking about having enough food to eat. And we started hearing about having access to basic healthcare, mental care, and those kinds of things. And so that really was the genesis of us beginning our journey into, instead of looking at philanthropic partners for dollars, which we do need, we started to look at thought partners. And I see Dr. Abelson here from the Hope Center. And that's when we started to partner with groups like the Hope Center, with the Meadows Foundation, different groups that were helping us learn more about what our students were experiencing. And then we saw that there was a tight correlation between these basic needs challenges and mental health. They were inversely impacting each other. So again, that's really when our journey started from an organizational perspective. And we knew we needed to grow capacity as an institution and continue to do that research, continue to understand what the student experience was actually happening, what was taking place with our students.
Anything to add? No. Yeah. To follow up on that, what are some lessons you learned about bridging silos and, overcoming some of the divides and divisions and just lack of coordination that often exists in these spaces?
Sure. For Alamo Colleges and for y'all who aren't familiar with y'all familiar with the Alamo? All right. Okay. So we're in San Antonio, Texas. We've got we serve about 100,000 students annually, and about 71,000 by semester. So again, it's a complex place, right? We're 5 independently accredited institutions. We're the only system left in Texas that still operates in that way. So it's 5 college presidents, 5 vice presidents of college services, 5 vice presidents of student affairs. And so again, so on and so forth. And so for us, it really meant developing a system of cascading information across the system. That meant bringing all 5 colleges together. That meant really strengthening our communication pathways with each of our leaders, each of our organizations, and also making sure that data was front and center, that every conversation was being led by data. And so, we went from a place, 10, 20 years ago where we were the least performing community college in the state of Texas. We're the least for credential generation. And then we moved to a place where we were first in the state of Texas for credential production. And so that went from students graduating with 120 hours of hours, 126 hours to graduation, down to about 62 hours. That's our average graduation time now for our students to complete their credentials. So for us, it's really been a journey of communication with data, telling the story to really create impactful change across the system.
So Dallas College we have about 135,000 students. We're the largest undergraduate institution in the state of Texas. And about three and a half years ago, we consolidated 7 separately accredited campuses into one college, Dallas College. And I would say that if that hadn't happened, it would be well nigh impossible to move forward on scaled system-wide approaches to serve a population as large as we have. In terms of collaboration, one of the things that there are a couple of things that we've found. One is that there's been a lot of effort on the academic side of the house in North Texas and in other Texas communities as well. Vertical integration, if you will, K-12, community college, upper division universities on academic side. How did we assure seamless transitions? How does information pass seamlessly, from various levels of those institutions? And there have been a whole lot of problems solved in that area, and even right on into the workforce with employers. And so now, from a strategic point of view, it's like, well, how do we leverage relationships that have been built on the academic side of the house between these institutions and the leaders of these institutions in the student services side and around issues like mental health? There are huge opportunities to do that and to leverage enterprise-wide software and IT systems, for example, which are interoperable across a lot of these institutions and create the capability for shared case management strategies for our students in student service areas and in areas like mental health. There's a lot of issues to unpack there in doing that type of thing, but that's the type of work we're engaged in. So there's that vertical collaboration is one aspect of it, but then looking horizontally within the community. And every county in the state of Texas is served by a local mental health authority. And, as I work with the Meadows Mental Health Policy Institute. I've been there for about 10 years, and we've done a lot of work in local communities. And you go into communities and you convene stakeholders around higher education or around mental health at the local level, and the higher education leaders haven't necessarily met the leaders of their local mental health authority or the leaders of their public hospital. So educational institutions are great conveners of folks to consider strategies like this, and it results in some great work. So, for example, the largest provider of mental health services in Dallas County to the primarily uninsured and underinsured population is MetroCare. And MetroCare, just 3 or 4 months ago, thanks to Dr. Cruz and a lot of great work by the folks at MetroCare, they are going to be locating mental health clinics on every one of our 7 campuses and providing access to care. And they're going to handle the billing for those services and get it paid for, but it's going to be delivered on our campuses along with telehealth access as well. But so those kind of horizontal partnerships in the community, and then thinking about how do you manage students, and especially high-risk populations like foster care kids and justice-involved kids as they progress through the various layers of the education system is a key part of our thinking.
Yeah, I want to get back to some of the systems level changes and the policy funding levers that enabled it, but I'd be remiss not to invite Kay into the conversation. And you're a peer provider, right? We might have a general sense of what that entails, but tell us what is that role? What does that role entail? And tell us your story of how you got involved in it.
I would love to. Thank you all so much for allowing me to be here. This is super exciting. Mental health is not just work for me, it's my lifestyle. I live by this every single day. And so as I'm sharing with you all, I hope that when you take my story back, you share it with compassion and love, and not just because you know a student that has gone through this. So I'm in Austin, Texas. What they did not say in my intro is that I'm dually enrolled at Austin Community College, where we have 11 different locations and we service about 100,000 students each year. And I'm very proud to be a board member of the Amplify Center, where we service young adults ages 18 to 29. And all you have to do is be enrolled at the college and you will get psychiatric services and counseling for free. And right now we are waitlisted because, again, it's free and we service about 100,000 students, but that doesn't mean that we haven't got the ball rolling on something to help us out. I have benefited from services at ACC, which truly changed my life because I moved to Austin in the middle of the pandemic. So what do? You need somebody to lean on. And then I graduated from Austin Community College last spring with my psychology degree, thinking, man, what can I do with this degree? I got this degree, I need to do something, but it's only an associate's degree. So luckily in Texas, there's something called Mental Health Peer Support Specialist, and it is a certification that is accredited through the Texas Certification Board. And right now I'm in the provisional stages, still getting my hours. And what we provide is our own lived experiences provides compassion and it is centered around story-based telling. Now, we're not therapists. We're not out here prescribing people or anything. We're not telling them things that therapists would do to get us in trouble, but we're merely walking alongside of them in their journey. And that's what community college students need. That's what college students across the globe needs. We need somebody that can walk hand in hand with us, not tell us what to do and how we feel and what we should do about it, right? And so peer support for me means that I can actually be I can be in advocacy roles for those of us that cannot come up here to DC to be on the Capitol to advocate for those across this, not only Texas, but across the United States. And so I take my role as a peer support specialist very seriously, and we are changing lives, and I hope that other states adopt it. And I believe right now 39 states allow it to be billable through Medicaid, which is, again, saving lives. And so I hope that you all take this back to your states and wherever you are and in your policy making and use these strategies.
Can you share some examples of the types of supports you provide to your peers?
For example, I can go and talk to them about where they would like to meet at, what they like to do for fun. We go and do those things, and I'm just listening to them. That is the number one thing. I'm just listening, right? I've been in therapy spaces where my therapist is trying to overtalk me or talk about their own experience. I don't tell my story without their permission, and I only tell a little tiny part of my story that's relatable to it, but it still maintains that relationship with them so that I'm not infringing on their experience and so that they continue to come back. And there's a lot of mental health crisis happening in Texas, but when you have somebody that's living the experience with you, we're also in college together, we're all working, we might be married, we have kids, there's somebody that is exactly in the space that you are in that understands what you're going through, it's better received that way. So I love being a peer support specialist. That is my jam, and even as I go on and go off to law school, I'll always be a peer support specialist.
Yay.
Yay.
I just want to say it's been really cool meeting Kay. And we hadn't met before this panel started, and the voice of the student. I mean, this is all about you and the students and that we serve. And one of the greatest barriers that we face still is the stigma around mental health. And so things like propagating peer network strategies, arming other students with the ability to talk to other students, going through a training process like peer training and perhaps earning a credential that could be valuable in employment in the workplace and help move into the behavioral health workforce, which there's a variety of ways to do that, is so important. But your generation thinks about mental health in a different way than a lot of people. It's like, I heard a student tell a story once. Says, "Oh yeah, my roommate's bipolar, and I help her stay on her meds. Check on her a couple times a day." I mean, people wouldn't have done that back 15, 20 years ago. So you were the key, my dear. You really are.
Absolutely not. I come from a generation of my parents and my grandmother thinking like, oh no, that mental health, that's not a thing. You need to go talk to Jesus about it. Or, therapies for white people. They just come from all these stigmatized backgrounds. And it's like, no, therapy is for everybody. We all have these things. And the gag is that coming through the pandemic, we all have mental health issues. Nobody in this room is not okay, right? We all have issues going on. And so I think that we talk so openly about it because we don't have a choice. Because if we don't talk about it, we're not making it to those graduation rates, right? We're not making it past this room. We're not making it to the next day. And so many of the people that I've loved have gone on because of their mental health issues. And that also fuels why we have to talk about it.
Well, thank you so much for what you do and for being such a great role model. I want to get back to you in a bit, but we'll kind of pivot back to the policy conversation a little bit. In our prep call and just now we were talking a bit about the Texas Higher Education Coordinating Board and its role in some of these systems level changes. So any of you, talk about this body and its support for the work that's been done.
Sure. So the Texas Higher Education Coordinating Board is our governing body for higher education. State of Texas governs 2-year institutions as well as 4-year institutions. And then they also develop an agenda, right? And that agenda is what gets taken to the legislative session every year. So with the Texas Higher Education Coordinating Board, they've also put out a series of grants. And so for Alamo colleges, that's been a really big mover for us. We've been able to engage with the coordinating board with those grants. They generously provided us a grant for $200,000 to kind of begin the genesis for one of our major healthcare or mental health initiatives on our campus. Additionally, they've changed the funding structure in Texas, right? So the funding structure in Texas is now a fully performance-based funding structure, right? House Bill 8. And so that was a big game changer. But what it did, it really increased the accountability for organizations, institutions to make sure that they are not only enrolling students, but that we're graduating those students. Our funding model used to be based on enrollment, right? So it was who's there on census day, and that was a big number and that was important, right? But it really changed the conversation about what we were investing into the supports we provide for students, where we were putting our dollars, where our priorities were, right? And so this last funding year, typically Alamo College's district, 5 colleges, we receive $5 million as an organization for the entire system. This last funding year, we received $25 million. And again, this was based on the generation of credentials, right? Credential production, generation of high value, high demand, high wage credentials. It also looked at, it's looking at student parents. It's looking at adult students, 25 years plus. So again, it looks at a lot of different factors to really hold institutions accountable for what they're doing in the classroom and where they're putting those resources. So again, I think the coordinating board provides a very strong structure for us to move forward and ensure that we really keep students first.
That's great. I mean, this outcomes-based funding is really good for those of us who care about mental health. And, you know, if there's one thing that's happened in the legislature and also in the coordinating board, you know, there is a recognition now that mental health is determinative of student success, and therefore we have to focus on it. And, you know, that has not traditionally been the emphasis of the coordinating board or the legislature. It's been very much, again, on that academic side. And what the coordinating board is leading and what Commissioner Keller is leading today is a recognition that there needs to be a system-wide approach in Texas to student services as well. And what does that look like? And so, you know, the implementation of House Bill 8 is a huge challenge. But one of the things that's going on now is, you know, the creation of those metrics and accountability platforms in student services so that, you know, we can ultimately get the student success that we want by this really critical non-academic enabler of student success, which is mental health. You know, I would say as well that, you know, Dallas College, you know, this has had a big impact in terms of how we approach our management and accountability at Dallas College. And shortly after our 7 colleges were consolidated, we also hired a new chancellor, Justin Lannon. And he was very supportive of the board's suggestion that, hey, let's put a significant part of your compensation, you know, basically 35–40% of your compensation at risk based on performance metrics. And so his performance metrics are all tied to, you know, student progression, enrollment, you know, many of the identical metrics that are in House Bill 8. So all of a sudden, you know, he's incentivized and accountable for reaching these goals, and he's cascading those metrics and that accountability down inside the organization. And it's justification from a board of trustees perspective for using taxpayer dollars on student services like mental health. Dr. Cruz gave a presentation to our board last month and on mental health and student services. And we basically doubled that in the past 2 or 3 years, took all the savings from consolidation and put it into enhanced student services, making the bet that that this would result in improved outcomes. And what the data shows is that, you know, 15 to 20%, we have a 15 to 20% higher progression rate of students at Dallas College, you know, to another institution or to the workplace if they're touching our student care network than if they don't. And so that's absolutely worth investing in. We still got work to do because not enough of our students are accessing these services yet. And we have work to do in terms of making sure that they adhere to those services, that they continue to use them as they progress through their journey at Dallas College. But all this accountability is being driven by House Bill 8 and the way that community colleges are funded.
Well, and I just wanted to also add, so with that additional $25 million that were received the following year, we saw our numbers go up about 82% in number of mental health counseling sessions we provided to students. And we also saw a 25% increase in the number of students we saw. We were also able to change our counseling ratios. So at Alamo Colleges, we've got ratios for advising, we have ratios for veteran services. And so for counseling, we had a ratio about 1 to 9,000. That was the last 10 years, right? About 1 to 9,000. That was the ratio, which is right? How can you be impactful, right, in that way? And through that funding, we were able to lower that ratio to about 1 to about 2,500. So again, not where we want it to be, right? Not the recommended guidance, but certainly an improvement going in the right direction. We were also able to invest another $500,000 into a virtual mental health provider who provides now services for our students on evenings and weekends as well. So we, seeing the data says it all, and we also see that our students that touch mental health counseling have about a 10% higher persistence rate on average across the colleges. So again, that's very, very telling. And students who work with our, very similar to Dallas College, we have a student advocacy network. We know that their completion rate is 3 to 5 points higher on average across our system. And we know that their persistence rate is about 9 to 12% points across the system on average as well. So again, in reinvesting the dollars back into students where we know the data's pointing, the data told us where to go, so I can't emphasize enough the need. And again, I know there's all different kinds of people in the room, but for those of you that are practitioners or those of you that are policymakers, that's what I would say is make sure that is first and foremost at the beginning and at the end of the day, the thing that you're looking at. And then finally, student outcomes, right? At the very end of the day, we want to see that it's actually making an impact and not on a niche or a pilot, right? We want to see wide scale adoption and implementation, and we want to see strong student success outcomes.
I have to touch on this. House Bill 8 is so near and dear to my heart because I am one of 12 students that worked on House Bill 8 alongside lawmakers. Shout out to Student Advocacy Council. We spent a whole year just learning all this language, figuring out what's going on. Before House Bill 8, think about this, community colleges had not been looked at in 50 years for finance. That is a long time ago. So 50 years ago, who was going to college? Who was going to community colleges, right? Who was actually receiving that funding? And so at Austin Community Colleges, we're getting about $6.8 million in funding from House Bill 8. Thank you all. And so ACC just passed free tuition for students graduating from high school as of 2024. And so what that does, that'll cost them $7 million with the help of the $6.8 million to give those services, wraparound services, grants, funding, student emergency aid, food pantry. I mean, everything, you name it, it is possible to do. But because House Bill 8 was passed, we were able to help people out with tuition. And although obviously that comes with, certain things that they have to follow and guidelines, that's still offering a chance to that first generation student, such as myself, to go to college and even get a feel for it without having to worry about all the things that come with going to colleges and trying to figure out FAFSA, which you still have to fill out. But it still makes it a little bit easier when you see that 0-0 on your balance and you start your classes and you can get those textbooks from free from our student services support. And so when House Bill 8 passed, it was just one of those things that didn't just affect us, it affects the people that are coming behind us. And that's the whole point of this work, is to make life easier and higher education for students coming now, before us, and after us.
What don't you do? You're just like everywhere. Talk about, your experiences, lessons, getting buy-in from the ledge and the governor. Obviously it's a very divided time nationally, everywhere. It's hard to get consensus on legislation and other pushes like this.
I'll give that to Phil.
There was leadership all over the place on that, and there continues to be, and some of it was driven out of crisis and tragedy, mass shootings, some occurring in schools. Hurricane Harvey, which was, I think 2017, 2018, devastated the Houston, the Gulf Coast area, many cities in Texas, and there was a recognition that, hey, there's a physical crisis to, and a housing crisis and FEMA-like stuff to deal with, but there's going to be a mental health crisis coming in a year or two after this because of the trauma that so many families and so many students experience. And fortunately, the legislature got out in front of that and said, how do we plan for that? How do we deliver services? So there were those types of events. Champions, Speaker Joe Straus in the Texas House made this mental health a top priority. Put his best people on the select committees that were dealing with it. Senator Jane Nelson chaired the Finance Committee, wrote the budget. Really, this is follow the money if you want to figure out how to really solve some of these problems. Well, she was all about what Gilberto was talking about in terms of, we'll spend the money, but you're darn well going to be accountable for it and show us your data. So the governor has got a lot of interest in this issue, and certainly from a student services perspective and the kind of things that we're talking about here, but also the workforce perspective. And the governor issued an executive order just within this past week directing the Texas Higher Education Coordinating Board to come up with a strategic plan for dealing with the behavioral health workforce shortages in the state of Texas. So there, chancellors of university systems, presidents, there's a whole lot of leadership, that's been brought to bear to create the imperative in the legislature. And it's there's a lot of crazy stuff coming out of Texas right now. Y'all read about it, right? But, on this particular issue, I couldn't be prouder of our legislature and our leadership and what's happened. So
I think it's also, a combination of the work that Commissioner Keller's doing. Commissioner Keller has charged his folks to work with institutions in Texas to work on the mental health discussion, and actually working with Dallas College, right? And Dr. Cruz over at Dallas. And I got to give a shout out to Dr. Cruz because they stole him from Alamo Colleges. He was at Alamo Colleges for a long time, and he was unceremoniously stolen. And so we're working with Dallas College, working with Texas State System as well, as part of a Texas coalition, working with the State Higher Education Executive Officers Association. And we're developing what will hopefully be a strategic plan for how we deploy mental health services to college students across the state of Texas. And so we're working with a small group of institutional leaders, working with the Meadows Foundation, working with JED, working with, of course, with the coordinating board, also working with Hope Lab as well, right? So we'll be going to Minnesota here in another week or a couple of days. Yeah, something like that. So we're going to be going over there, and we're going to be working with 5 other states to present how we deploy best practices across the state of Texas, and then come back and over the summer develop a plan for statewide impact that Commissioner Keller can then take again and make part of his legislative agenda. So again, I think that having a body like the Texas Higher Education Coordinating Board really gives us a vehicle to speak to the legislature, and it gives us a great champion in Commissioner Keller for the work that we're doing at the organizations, not just on the academic side and degree production and those kinds of things, but also in making sure that students are okay. At the end of the day, I had a student tell me one time, when you're living in your car and you looking for a place to take a shower and you're eating a sandwich from 7-Eleven, how important does that quiz become the next day? How important does that test the next day, or even just homework? How really important is that? And what kind of headspace are you in, right? So again, I think that the work that we're doing as a state with the guidance of the coordinating board, different institutions within Texas, is really just kind of, I think we've come a long way in the last 5-10 years for mental health.
Just, one other factor that has been critical in the state of Texas, with both the legislature and also at the community level, has been the role of philanthropy. And I want to share the story of the Meadows Mental Health Policy Institute, because the Meadows Foundation is the largest family foundation in the state of Texas, and it's been alluded to a couple different times here. And their CEO was a woman named Linda Evans. She's since stepped down, but they've had mental health as a priority for 25 years or more. And the way Linda tells the story, it's like, we would fund a clinic here and a program there, and yet nobody could get access to services. She got mad. She's like, we're not going to do this anymore. We got to come up with a different systems-wide approach. And so Linda convinced her board to invest in a 2-year planning process on what would it take to effectuate systems level change in a state as big as Texas. And we're 30 million people now. And that 2-year planning process resulted in the business plan for what became the Meadows Mental Health Policy Institute. And it started with just a couple people. Today, the Meadows Mental Health Policy Institute has over 160 people working for it, all kinds of backgrounds, clinical people, payment specialists, attorneys, you name it. And MMHPI has been going into these communities and, understanding what is happening. What does the system look like today? What is an ideal system that you can shoot for? And how do you create the collaborative planning processes to reach that ideal system of care in your community. And, and other philanthropists have invested in that process. I mean, it's kind of been a galvanizing point. I mean, Lida Hill, foundations like Kronkowski, Methodist Healthcare Ministries, I mean, Houston Endowment, there's been a galvanization of philanthropy around an institutional systems agent, which is what the Meadows Institute is. And that work is now being done in Texas and in other parts of the country and here in Washington. The Institute has a presence here in Washington, recognizing the important lever of federal policy in dealing with systems level change in mental health. So philanthropy, and you think of the influence that board members of philanthropy have on members of the legislature, that's been a key factor in terms of capturing the legislature's attention as well.
I wouldn't be remiss if I didn't bring up LEDGE. And as an advocate that I am and sitting in this space, I have to talk about SB 17. Senate Bill 17 was passed and DEI legislation went into effect stating that, DEI kind of got erased from higher ed spaces and people were let go. And, it's not supposed to touch student research and all the other things, but it is. And I want to paint a picture for you all. So I want you all to think back to when you were an undergrad graduating and, who was your support system? Who did you lean on in times of need? And, some of y'all may have to think a little bit further back than others, but that's okay. Just a little giggle. But think back to that person and you're going, and it's April of your senior year. And I'll fast forward you to the students that are graduating this coming semester. They started their undergrad in the pandemic. They were virtual. Freshman year, sophomore year, virtual. Junior year, they come on campus. They are freshmen because they don't know how to navigate campuses, right? And so they keep going, And then all of a sudden in April of your senior year, your support system gets fired. They're no longer with you. You no longer have that support system that has been keeping you along and navigating you along, especially as whatever, background you come from. That is what we're dealing with in Texas right now for mental health. And so as you all are putting in your policies in place, remember, you're not making policies for people that are, you owe a political favor to, if you're looking for political power and all these different things. We are truly being affected. And although I'm not graduating until next fall, all of this is impacting us. And so as you are pushing legislation to your legislators, yes, we celebrate House Bill 8. Yes, we celebrate all these wins and gains. But what bills like this does is set us back about 300 years. And it makes me think that my grandmother, thank you. It makes me think that my grandmother, who's almost 90, has never felt safe in this world ever a day in her life because she keeps going through the cycle of all these bills and all this legislation that happens. So when you're passing these laws, don't pass them because you owe somebody a favor. Pass them because your stakeholder right here who's paying to go to school, who has $61,000 worth of debt to go to school, that's who you're passing those laws for.
I'm really glad you brought that up. It's obviously an elephant in the room to some extent. That's actually a good segue to a question I was going to wait to ask you, but I think it's a good opportunity now. Is I was half joking, but it's true. You're the most important voice on this panel right now as a student. What do you want the leaders in this room to know about the mental health needs of you and your peers? And what are you hearing and seeing in your communities and among your peers right now?
I like to consider my peers to also be my colleagues, so my professors, right? I am not in K through 12. You are not on top, you're not my authoritative figure. We're colleagues. And so what I'm seeing is people are losing their light. You walk on campuses and they feel so lifeless. The halls are empty. Nobody's there. Empty offices. People are devastated. But I wrote a little something to y'all, just a little message, and I wanted to make sure that I had it. And it says, although this may not be impacting you directly, this doesn't mean that it has nothing to do with you. Your field is under attack, and we are your stakeholders in higher ed. And when bills like this get passed, our power gets taken away. And if you are in this role for anything other than good, you probably should reconsider policymaking because you work for us and never forget your reason why you got into this field. And so as we go on in Texas, and I'll continue to advocate, I know my grandmother's watching like, man, I'm so afraid for you. She is like, girl, be quiet. Please, girl, stop talking to them people like that. But I'm like, Grandma, we have to do this. And so I do this work for her, who taught during segregation, desegregation, all the things, the whole loopholes. But what I'm also seeing is that we're learning more about how higher ed works and how our chain of command works and where the money's coming from and where it's going and what department is doing what. And so that'll continue to build all of the people that are now going to be into law and going to law school and doing this advocacy work, and even if they don't go to law school. And so what I'm seeing is communities coming together, and it's no longer our professors advocating for us, we're advocating for them. And it's kind of interesting that the roles have flipped, because we're finding this sense of power and call of duty to do this work, even in times of feeling, down and hurt. And the first time I talked about this was in New Orleans at another conference, and I was just so destroyed and so hurt, and I almost couldn't get my words out. But now I've been thinking about it, meditating about it, kind of leaving it up to the higher powers of things. But it's it's time. We need y'all's help. Y'all may not be in Texas, but Texas needs y'all.
I wanted to zoom in a little further in some of the specific programs you all are involved in. And you kind of alluded to this earlier, Gilberto, but Alamo Thrive, right, is sort of the signature program in your community college system. Tell us what that looks, and again, to keep it from the student perspective, what does this look like from a student's perspective?
Sure. So Alamo Thrive, the genesis of that started, prior to about 2022. I talked about, we had started collecting data. We had started setting up our student advocacy network, food pantries, clothes closets, emergency aid, housing vouchers, right? We started having that discussion, and we started to kind of see the trend data. We started to see the increases in mental health appointments, the increases in counseling sessions. We started to feel all of those things. And right about that time, again, the coordinating board comes out with an RFP for a grant. Trellis Foundation as well, great partners with Trellis Foundation, which was formerly Texas Guaranteed Student Loan, right? Can't believe somebody I owed so much money to is doing such great things for students, right? But again, doing great work. And so again, these two amazing bodies came together with a planning grant, right, for the organization. And so that allowed us to partner with Hanover, right? I'm sure many of y'all know who Hanover is. And so they came to campus, they did focus groups, they did research with our students, with our faculty, with our staff, and we started to really understand what those gaps were. So in about summer of 22, our Thrive Committee came together, which included members from all 5 colleges, student population staff from veterans and VA, child care centers. Again, a really, really broad group of stakeholders from across our organization who started meeting regularly with a JED coach. So through the grants, we were able to partner with JED Foundation, right, out of Florida. And so JED Foundation then assigned coaches to our colleges, and then each college was able to develop a strategic mental health plan. So that created a pathway for our students across all 5 colleges that focused on creating peer supports, peer educators, right? Partnering with Active Minds across all 5 colleges. Also looking at eliminating stigma around mental health. So that meant lots of programming around, let's talk about mental health. Mental health is fun, mental health for faculty, mental health for staff, assist anti-suicide training, trauma-informed care training. We were able to train over 2,000 faculty and staff in multiple areas. So again, we're really, really starting to go down that road of becoming an organization that said mental health care is first for us. And then that led into partnerships with UT Health Science San Antonio. We now have psychiatric nurse practitioners that are on multiple campuses. We have health clinics that are on 2 of our campuses. We also have telehealth services that are available, the virtual evening, weekend mental health care as well. So again, it really allowed us to really capitalize on our partnerships. And for what it looks like from a student is really just a lot more visibility, right? So we had key metrics with those grants, key metrics around eliminating stigma, doing that data collection, also social media posting, what our social media messaging look like, what our marketing and communication flows look like. So again, we were able to really track all of those metrics to see that we were seeing changes. And again, it led directly to those, or didn't lead to directly to, but we saw increases in the student academic performance.
Does it feel like any of that work is in jeopardy because of what Kay described, the context that's playing out right now?
I think it's always in jeopardy, is what I would say, right? I think that the landscape can change at any moment, depending on who's in place, right? But also, I think it also depends on landscape trends, right? What happens with enrollment, what happens with student success outcomes. If those student success outcomes don't repeat for whatever reason, right? If there's an impact of learning loss from COVID when those students enter, traditionally our students are entering at about, I believe, 50% underprepared already. So again, there's a lot of different things that can happen. So I think that, the position of higher education, while it's strong and it's supported, I think that the landscape can change in an instant. But the organization is still very much committed to mental health. We have an infrastructure we've put in place. It's a line item. It's not, from the grant funding, we went to institutionalization. So we felt so strongly about it as we institutionalized it. But I think that the landscape in higher education, it just changes so quickly. It changes very, very fast. And so I think we need to be agile. We need to be prepared to make decisions that keep students first.
Question for you, Phil, and then I'll ask a big picture question to wrap us up for everyone. You mentioned your work at Meadows, and you kind of straddle these, Meadows, and you're also at Dallas College. One thing we all hear a lot is that one of the biggest barriers to succeeding in this work is capacity, right? So what are some of the ways that Meadows has helped institutions think creatively and effectively about increasing capacity or dealing with limited capacity?
Sure. Yeah, I mean, one of the things the Meadows Institute does is it does a lot of work with prevalence data. So you take a population, whether it's a college population or a county population or a state population, and develop numbers on what's the prevalence of various types of mental illnesses. And by far, the most prevalent are depression and anxiety, but bipolar, schizophrenia, and other forms of severe mental illness are out there as well. And you can build numbers around prevalence. And then the question is, okay, what kind of capacity needs to be put in place to deal with the prevalence of the diseases? And one thing about mental illness that I've learned, and I didn't know, but from clinicians, I mean, mental illnesses are progressive diseases like cancer. So stage 1, 2, 3, and 4. And our system's designed not to deal with a lot of mental illnesses till you get to stage 4 and someone's homeless or in jail or dealing with crisis. And we need to change that. I mean, if there are two core principles, I think that the Meadows Institute has propagated in the state of Texas, not just in education, but with health systems and the justice system, with veterans mental health care as well. Number one is early detection and screening. How do you identify people at stage 1 of a mental illness and get them into treatment, get them into care? And oh, by the way, it's a lot less expensive to treat at stage 1 than it is at stage 4. And then the second thing is, leveraging the primary care system. Most mental illnesses, probably 80%, and especially mild to moderate depression and anxiety, which is so prevalent today, can be treated in primary care settings by internal medicine doctors and pediatricians. But they don't necessarily have the tools or always the training to do it, and the billing and the reimbursement systems aren't in place for treating mental illness in primary care. And so those two control points have been huge focuses of the Meadows Institute in terms of making sure that we have the capacity to meet the prevalence of the disease. There are a whole variety of new clinical delivery models that are being created to deal with this issue. And I'll mention just one, which is called collaborative care. And so inside primary care systems, you've got these doctors, they can treat mental illness, but how do you set that up? Well, collaborative care is all about having a psychiatrist at the top of a tree, maybe working with a dozen or more primary care docs to treat thousands of patients that maybe think they need to get specialty care, but could actually be treated in primary care. Well, one of the key jobs that's new to make a collaborative care model work, and by the way, virtually every major health system in Texas and in other parts of the country are working on implementing this model, is a collaborative care manager. And this is the type of, which is it's not an MD person, but it's a person who knows how to bridge primary care docs, when to refer up to the psychiatrist. How do you do meds management? How do you work with a team of social workers to ensure adherence to treatment and stuff like that? That's a whole new job that didn't even exist yet today. And so Midland College in Texas is working on developing a certificate, a certification, a non-academic stackable credential, in collaborative care management. And so that is part of the strategy for meeting the prevalence, make sure we got the capacity to meet the prevalence of the disease. And that's what Meadows has been working on.
Awesome. So last question, and I want each of you to share your thoughts on this, but we've been talking this morning about the Texas story. What do you guys hope is the next chapter in this story? What do you hope the road looks like moving forward?
I'll go first. I think chapter 2 should be called perspective. When we start to shift our perspective, it changes things, right? And so one of the biggest things that I've been working on is how do we get people to see things differently? So for example, y'all say homeless people experiencing homelessness, people, foster care kids, they are in the foster care system. We have to stop putting them as like character flaws on people in order for us to build and create different things, because they're not going to always be there. We're not going to always we may not always experience a mental health issue, but we'll always have that to lean on as, okay, I worked through that. That was my story. It's not who I am. And so I challenge all of you to shift your perspectives, and Texas, number one Texas, to shift their perspectives as they start to create these bills and change these policies to help us get better. And the quicker you change your perspective, you'll start to seek and yield those results that you're looking for, and that the people that need them will be able to have access to them.
I would say that I hope we get better about having difficult conversations, because a lot of these conversations are challenging, especially when it comes to dollars, right? But I can think of nothing more important than the future of our communities and these students that we serve, and their futures and their lives, and their ability to earn a living wage. And I think that those things sometimes don't always line up, but we have to be willing to have those difficult talks, and we need to be able to support our positions with data, right? I think the data needs to sit at the front, because it helps streamline a lot of those conversations. It's really, really hard to argue sometimes when you see the data and you see what's happening and say, yep, there's something there that needs to change. So again, I think we need to be better about having those kinds of conversations.
I'm excited about what the future holds in terms of innovation. And, if ever there was an area that was ripe for innovation, the intersection of higher ed and mental health, I think, is one of them. We are beginning to explore, Dallas College, how we can use our enterprise software and IT tools to better serve our students and to better assure their success. The legislature is encouraging, we've got about 50 community colleges in Texas, and you've got ones like Alamo and Dallas, we large property tax bases, lots of resources. How do we share things like enterprise IT platforms and telehealth networks with maybe the 40 colleges that are serving rural areas and perhaps don't have access or the staff to do those kinds of services directly themselves, but could share them with larger community colleges? That's going to be an exciting business model and policy challenge to unfold. AI is going to be a big part of this, and I'm not sure exactly how, but it has the potential to dramatically increase the capacity in certain areas of student services. And if you think about, hey, if there's a way to use AI to handle, more routine intake tasks and that type of things, initial screenings, that type of thing, so that our staff and our highly trained counselors, can focus on the higher acuity types of cases that would otherwise go off the rails without that attention. That's a great opportunity for innovation, but we've got to imagine what those student pathways look like, what those IT systems look like, what that shared infrastructure looks like. So innovation will be a big part of our future.
I also have one more thing. Go talk to your students. When's the last time you even talked to a student in real time? I was at a conference and I asked in February, when's the last time you talked to a student? And they said October. That makes no sense. If you're passing legislation about us, talk to us every single day or at least once a week at least.
Fantastic note to end on. Well, let's give a round of applause to our panelists. Thank you so much.
Good afternoon. I don't think this is really working. Good afternoon.
Good afternoon.
Okay, that's much better. What a great turnout. And I want to begin by thanking those that made today possible and just told me hold it a little bit higher. So thank you for taking care of me. Please join me in thanking all our staff for today. I want to welcome all of you here and those that are participating online. Thanks for being here. Thanks for all you're doing. And we have a wonderful panel that we are going to be discussing a few items here. Looking forward to your comments. Keep telling me that I should keep the mic higher there. All right. So I'm Nasser Peydar, Assistant Secretary for Post-Secondary Education. Prior to this, I worked in higher education for over 36 years, including being Chancellor of a couple of universities, including Indiana University. During my time as Chancellor, I learned a lot about higher education, and I also learned about the issues that students deal with mental health and how mental health is hurting many people out there. So while we tried solving that problem by adding more counselors, we learned very quickly that you can't hire your way out of this. You have to have other strategies. There is more to this. And I'm delighted to have this conversation with our colleagues here to look at what are the challenges, what are the obstacles, what are the things we could be doing. I should also thank IHEP for their partnership for the event here. I forgot to do that, so please join me in doing that. So let me introduce, if I could put these paper over there, and let me introduce our panelists here. Delighted to have Christina Sedney, Director of Policy and Strategic Initiative at the Western Interstate Commission for Higher Education, and who brings insights into state-level strategies and cross-sector collaboration. Why don't we, as I do that, show your appreciation and support for them. Laura Horn, Chief Program Officer at Active Minds, who will share her extensive experience in empowering students and promoting public health approaches to mental health. Thank you for being here. Dr. Zainab Okolo, Senior Vice President of Policy, Advocacy, and Government Relations at the JED Foundation, whose work focuses on comprehensive approaches to mental health and suicide prevention. Thank you for being here. Kyla Suarez, a student and co-founder of Astro Studios, who has effectively used media to support and engage young people in mental health discussions. Welcome. Panelists, I'm hoping that in our discussion today, we will talk about the major barriers to mental health care for students and the innovative strategies that you're implementing to overcome these challenges. Hoping that we will talk about issues that could impact our capacity to support mental health initiatives and the role of policy in shaping effective mental health support for our students. So let's begin. Let me ask a question from all of you, starting with you. What would you say is one of the biggest barriers, or maybe the top 2 or 3 barriers to more students receiving the mental health care that they need? And how is your work seeking to overcome this barrier?
Sure, thank you. Do you hear me okay?
No, I don't think it's on.
How about now?
Do you want this?
Oh, sorry. Okay, how about now? All right, thanks so much. So I think from our perspective at WICHE, we work across the Western United States. One of the really major barriers is just the multitude of systems that are in place that students have to navigate to access. And so, if you are a 35-year-old at a community college and you need to use your Medicaid benefits in order to access mental health services, that looks very different than if you're an 18-year-old at a residential university and you have university health insurance, or maybe you're on your parents' health insurance versus Maybe we heard about in Texas at Austin Community College, where you have this wonderful counseling center that provides services free of charge. So there's all these different models, and behind these models there are these different ways that they are financed, that they are paid for. There's different ways you have to navigate those benefits, and so it's incredibly, I think, challenging for students to understand, and for institutions and even states to kind of present in a clear and concise fashion that's easy to navigate what's out there. And so that's one of the things I think, we've seen and even heard from students on the ground, that, it's just so confusing to know how to get help when you need it, and to build systems to make it easy on the front end for students. And so what we're really focused on at WICHE is learning from the great work that our states are doing and kind of sharing that and developing collaborative resources wherever we can, so that folks can learn from one another across these different contexts, and help them apply as needed.
Same question. Same question.
I can.
Same question to you.
Can you hear me?
Do you want?
Test. Okay. Hi, everyone. I'm Laura Horn from Active Minds, and we're a national nonprofit working with student mental health advocates across the country, primarily college and university students who are passionate about mental health, but also a growing high school network, and we're piloting a middle school program. And so we're constantly talking to students and asking them what they need. And one of our favorite things to do is to hear from students about an experience they've had, an idea for a program, and to scale it up nationwide for them. One of the biggest barriers that we think exists when it comes to mental health care is that students are defining mental health differently than our higher ed institutions. And increasingly, we feel that higher ed systems are not reflecting the values that students have. It's interesting, right? Because students pay to be there. They're paid customers. They are the primary consumers of the services and the resources and the education that they're receiving, but they often have little influence and power over what services they're given and how they operate. So we at Active Minds are focused on training students with the skills that they need to advocate for their needs, the tactics they need to use. We teach them about how the systems work. We show them students who've been successful in navigating the system, because we want them to be successful in elevating and amplifying the ideas that they have. I've been in rooms where students' needs have been said to be too lofty, and I've been in rooms where students have said their ideas are too small or insignificant. And what we really want is for higher institutions to know that there's a lot still left on the table. And we learn about that when we talk to students and we hear about their needs. For example, many, many years ago, a student Active Minds chapter, proposed adding 24/7 resources to their student ID cards. This was before 988, right? Many students didn't know that a 24/7 resource existed, and our students were talking from their lived experiences. They were sharing stories about how when they needed crisis support, it was after hours or on the weekends. And if they had had it where they always have a resource like a student ID, it wouldn't have been so hard to find those numbers. I've spoken with many families over the years who've lost children to suicide. Their students were on the phone calling ERs, making phone call after phone call and not getting the support that they need, and what it would have meant for them to have a number like 988. A couple years ago, the Trevor Project and Active Minds partnered together to do a research study to research how many institutions are promoting these 24/7 resources on their websites. Less than half were. And I hope that's no longer true now that 988 exists, right? And that would be something for everyone here. It'd be interesting for you to go and do. Go look. If you represent an institution, go look and see if your institution right now promotes those 24/7 resources and how much time it takes for you to find them. Because we know that this problem, as small or as insignificant as it might sound, is something that our students have said would really truly save the lives of their peers. So that's something that costs nothing. It costs about an hour probably to go put it up on your website. It costs nothing for schools to add to their student ID cards. And yet we know less than half of institutions just a couple of years ago were doing that kind of initiative. That's something that we hear from students. So when we're thinking about innovation, when we're thinking about responding to student needs, when we're asking ourselves, what would it take for students to feel like their campuses care about their well-being? We need to ask students, and I know that a lot of institutions are, and then we also need to listen to them. Students have been sharing for the past decade what they need in order to support their well-being. And if we're going to ask, we need to be prepared to listen, and we need to know that we're probably going to have to change some things that we do in order to respond to what they share with us and to respect and honor what they're sharing with us.
Thank you.
Hi, everyone. Thank you. Is it? Okay. Hi, everyone. I'm Dr. Zainab Okolo, again, Senior Vice President of Policy, Advocacy, and Government Relations with the JED Foundation. And when I think about one of the biggest barriers to really addressing the mental health crisis, I think about just the political context that we're all doing our work in. First of all, one thing that I think all of my colleagues and friends on here can attest to is that we're in a really unique time. So this policy window that we're all walking through, and thank goodness for such a fantastic Department of Education to take advantage of a season that we're in, is just that. It's a window and it is a season, and it's a costly one. It cost us a pandemic by which we lost a good percentage of our population. It costs us sounding the alarm that when we have a collective trauma like what we all experienced during the pandemic, there is no going back to normal. In fact, we need to redefine what normal is. And I know what I know now, what I knew about a decade ago, having been a practicing and having currently a practicing marriage and family therapist that is trauma informed, having worked with students day in and day out in private practice. The same issues that existed then still exist now. And one of those is how we go about, as my colleague just mentioned, defining mental health, crisis, wellness. These are not conversations that we were having as a nation. And broadly now, for us to really move the needle on that work, we're gonna have to get on the same page with the way that we are considering mental health and the way that we are talking about this, not only for youth, but for the nation. And what's important to remember is that given the political climate that we're in, given the policy climate that we're in, those definitions become all the more important, right? So I think that's a huge barrier that actually has a pretty easy fix, and that is to look at exactly where suicide is today, and where the urgency really lies. Because I think sometimes what happens is our attention, rightfully so, can get carried away with a lot of other things. But the CDC has already shown us that data right now says that suicide is the second leading cause of death for ages 10 to about 34. I really appreciate the silence that always comes over rooms when that data is put out first to kind of set the tone for the emergency that we're under. It is not trendy. We're not just looking for attention. Youth are not just crying out because they want attention. It is coming up in the numbers, and it's unfortunately trending in directions that we do not appreciate and we do not want to continue. So to do that, we have to get on the same page, at least with our language, so that when we put in place some of the ways in which we're addressing the challenge, we're measuring for the same things and that we're seeing the same impact across the nation.
Testing, okay. Hi, my name is Kayla, and I think as a student myself, one of the main barriers that I have when trying to access mental health resources is I often feel a disconnect from it, and I know a lot of my other peers as well feel the same thing. A lot of the resources that we get are shown in an email newsletter or the school website, which I'm not sure many students use, to be honest. And so when I see these postings of resources for mental health in an email, I feel very disconnected from it. It feels just a front almost for the school to be like, we're putting out these resources, so you can't say we're not trying. But a lot of the times I'll look at the Instagram of wherever this resource is coming from, and it feels very adult driven. There's a lack of youth at the forefront of that resource. And so a lot of the times, because of that, there is a power imbalance there and a power dynamic that a lot of students feel when they are talking to, whether it be a professor or a counselor or a mental health professional. It feels that you can't necessarily share your feelings about school or family or whatever it may be, because there's simply just a disconnect, and you know that they can't fully understand that. And so I think what's missing in a lot of these spaces, specifically school, you don't have that peer-to-peer interaction. We don't have spaces where we can simply talk to other students or our friends besides your dorm room or wherever house that you're living at. But there's no space on campus for students to simply gather and talk about their feelings. And so I think that's what's missing a lot of the times in school and outside of school. And so with Astro Studios, we like to think of ourselves as the Sesame Street for teenagers. And I'm building this alongside my co-founder, Gail Aitor, but he's not here today. And so what this means really is just teaching teenagers and young people in general how to deal with overwhelming emotions through media specifically. Research has said around 65% of young people are turning to audio to figure out how to navigate their feelings and learn to understand them. And that itself is audio. So that's just a microcosm of media at large. I think teenagers, when they don't have that peer-to-peer interaction, they don't have that connection with others in real life, they're turning to the internet. And it makes sense, right? Everything is oversaturated. But people are turning there to feel less alone. And so with Astro, we believe that media can be a supporting pillar to the mental health care system by making these insights from mental health experts more engaging and digestible to teenagers. A lot of times we're getting thrown facts at us and we're being told, you guys are depressed, you guys are, anxiety ridden, and et cetera, et cetera. And we know this, we're living it. And so we are turning that into youth-centered stories and experiences where people have that companionship, whether it is online. And so that's just putting young people at the forefront and sharing their stories. And through that, we're turning that connection into offline touchpoints through third spaces, as I mentioned before, where young people can go to a space to simply talk about their feelings, sort of like an emotional support club, I guess you can say. And so that's what my work with Astro is doing.
Well, that's wonderful. Thank you all for that. And getting back to your podcast, how many people are tuning in?
The podcast that I had was Teenager Therapy.
Yeah.
That was for about 5 years, roughly over 1 million listeners. And so,
wow.
Thank you. We started that when we were sophomores in high school. So I'm now 20, crazy, but I know.
Wow.
I know.
I was 20 once, yes.
But yes, so we started that when we were 15, and we did not think that it was going to turn into the biggest mental health podcast in the world. Really, what we were doing was just meeting weekly in our friend's bedroom, and we talked about our feelings. We cried on there, we laughed on there, we were angry on there. Just all the range of emotions that a teenager goes through was documented through that podcast. And what that was essentially was weekly emotional support meetings. And we didn't realize that. We simply just thought of it as, I'm going to talk to my friends for an hour, and a microphone just so happens to be there, and it just so happens to be uploaded to Spotify. But that was the premise, really. And at the core of it, we were authentic and we were ourselves and we were vulnerable, which is very hard to do nowadays, and rightfully so. I think everybody is very guarded, and to nobody's fault, but I think it just takes one brave person to say how they're feeling that causes a domino effect and a chain. And so that's what we saw with the podcast. We got thousands of messages saying that they felt less alone, how they got something from our stories. And that's really at the core of it. People just want to know that they're not alone. And so we did that by talking about our feelings in our bedroom. And if we can do it online, we can do it offline as well.
Well, thank you very much. That's remarkable. Thank you. Let me go back to you, Christina. You said you work with other states, which he does, and so forth. So What are the best practices of states supporting mental health of campuses, and then what are the bad cases, without naming them, that they are not really supporting? Any thoughts in them?
Well, I think we would. Is this working? Yes. Okay, great. I would describe it more as folks, being at different stages, right? Everybody has a different place they're starting from and going to. And we see a lot of exciting work going on right now. And I think we've heard about some of it today already. A few things that we've seen that we think have a lot of promise are pretty simple interventions. So one is simply having a staff member, the system level or the state level, who's really devoted to this work, who's focused on, what are all the institutions in my state doing? How can I advocate to the legislature? One thing that we heard this morning from Assistant Secretary Rodriguez was, in the long term, states are going to play a really critical role in this work. They will be the ones funding it for the long term, making sure it lives on and it can grow and serve the number of students it really needs to ultimately. And for that to happen, you need to have somebody communicating with the legislature, making sure that campuses have a voice, that the students have a voice. And so having dedicated staffing, I think, is really important, even if it's just, one person, a system office, obviously maybe a few more in a bigger state, is something that's really critical. And then also, we've heard about evidence-based practices all morning as well. And I think states have a really critical role to play there as well. So utilizing state data systems to make sure they're collecting information on how students are doing. We have one state, for example, that has a student well-being indicator and how they're looking at the success of their institution. So when those institutional presidents are going to report on how they're doing, they're talking about how their students are doing from a well-being perspective, which I think is really new and not something we've seen before. It used to be, here's our graduation rate, here's our enrollment numbers. And so I think small things like that are really important, or it's not fair to call them small, but maybe small in an investment sense. But then finally, also funding is really important. And so, for example, we have one state that started doing, a dedicated ongoing appropriation for institutional mental health initiatives. And that's really exciting to see. Yeah. And I think once we can see, how that's working and demonstrating the success, that might be something that other states might become interested in. And so those are just a few examples.
Well, thank you. Thank you very much. Thank you. Laura, you're present in 1,000 universities?
Yeah, Domains has a presence on 1,000 campuses. Yeah. We're most known for our student-led chapter network. So these are student-led groups on campuses, leading programs and bringing speakers to their campus, advocating for policy change in support of mental health.
When I was working in higher education and used to meet with student government, student advisory boards, and always ask them, what's in your mind? Mental health always was number one on their list. Yeah. Always, in the last 15 years or so that I've been asking that question here. So I think your presence on these campuses is just terrific.
Yeah, thank you. Yeah. I think, that's definitely held true, that mental health is one of the top issues for students today. I think, on the same theme of what we're sharing, when students talk about mental health, they're not thinking about just what happens in their campus counseling center or the programs that their campuses are putting in the newsletters, et cetera. They're thinking about their everyday on campus. They're thinking about how their faculty treated them that day. They're thinking about if there are protests happening on campus and how administrators are responding to those. They're thinking about if they experience discrimination in their week. This is what mental health means to them. And we have made so much progress in the last decade, and I think where we still need to go is getting this full campus buy-in and support for mental health and thinking about mental health in relation to these other social issues. Students are making decisions about where they want to go to college, issues like gun violence, reproductive health, DEI. These are mental health issues when it comes to our students. And unfortunately, these issues have been politicized. They've been weaponized, often in the name of students. Students are being told they can't handle what's on social media. We have to be careful about what we teach students because they might not be able to handle it. At the same time, students are being told that they're snowflakes, that they can't handle anything. And our students are saying, actually, no, we can handle intellectual debate. We want to talk about these issues. We want to learn while we're here. And before they they even get there, their campuses are promising that they're going to foster their learning. They're promising that they're going to give them that status. They're going to help them get the job that they're looking for. At the end of the day, students are on campuses because they need an education to make a life for themselves, make a career for themselves. And we need to think about how we can have the best mental health supports in the world, but if a campus is handling sexual assault cases in a certain way, or whatever it is, this is not a campus that's telling their students holistically that they care about their mental health and well-being. And for that, we need full campus ownership and buy-in, and we need to not be afraid to embrace some of these issues, even if they're politicized or weaponized, because this is what it means for students and their mental health. They want to be cared for, and that's what we're starting to see evolve through our student-led network, and that's where we're trying to meet them where they are. I was at a meeting a couple of years ago. It was called Moving the Needle. I was at a table with a bunch of researchers, and researchers are some of my favorite people, right? They ask a lot of questions, but they also have a lot of answers, and few people ever ask them for those answers, and so they'll get really excited. And one of the questions I had for them was, do you think that if we really centered students of color and queer students in what we were creating on campuses, would we move the needle? And it was unanimous yes. And it was like, well, we looked at the agenda, there was no session really talking about that. And at Active Minds, we've been around for 20 years. What we learned is that when we're there for everyone, when we're there for every student, when we're creating resources for everyone, we're leaving some students out of the conversation. And so we have made a commitment over the next 5 years to make sure that anything we create definitely resonates with students of color and queer students, because what we know is that often when we create new things that support a small population, everybody benefits, right? This is called the curb cut effect. If you think about curb cuts, they were meant for people who are in wheelchairs, right? But they benefit people who are pushing strollers. Text messaging is a great example of that, something we all know now that was originally created for people who had hearing impairments. Closed captioning, these kinds of innovations come when we work with students who've been historically excluded from how programs and resources and services are created. And we can know and trust that if this is going to work for them, everybody's going to benefit. No one's going to be left out. But in the alternative, when we don't take the time to center students who've been excluded and marginalized, we're never going to move the needle. And that's something that we're really focusing on, and something I wanted to bring to the table as well.
Well, thank you so much. Thank you. In our conversations, I was making notes. 4 times we talked about or said moving the needle. So Dr. Okolo, JED Foundation, what have you learned about what moves the needle?
Oh, well, for the past 25 years, we've been doing work on college campuses focused on our comprehensive approach. And a lot of that work has first been focused on ensuring that we create a culture of care that removes stigma from our college campuses. And we're so excited because just a few days ago, right on time for this here convening, we released our most recent research report called A Decade in Improving College Mental Health Systems, a JED Campus Impact Report. And what we did is we took a snapshot of the past 10 years. So that's just from 2013 all the way to 2023. And we looked at why and how our impact framework and our TA supports provided to our institutions, which is across 400 institutions, across 40 plus states, has really moved the needle. And what we found, just for some top data, is that for institutions that implemented our strategies, worked with our TA providers, were able to report 10% less likely for students to report suicidal ideation, 13% less likely for students to report suicidal planning, and then 25% less likely to report suicides attempts within the past year. And that's really important because there's a lot of work to be done. When we think about mental health, I think we think about not only just suicide prevention, which is where we're all aligned on this stage, we want to bring to zero, but there's also flourishing factors, wellness. How well do our students feel when they leave our campus? And we're proud to also report that students reported increased flourishing factors. And how do we go about doing that? When it comes to mental health, as I mentioned earlier, the context by which the work is being done is super, super important. And what we knew was that we had to ensure that we acknowledged mental health is not the job of the counseling center on our campuses, right? Remember, go back to 2020, just 4 very 10-year-long years ago. When higher ed was affronted with how are we going to deal with the mental health crisis, we kind of watched nationally as our counseling centers went. First of all, we were already overwhelmed by the demand prior to the pandemic. Now we're in crisis. We have state colleges that have ratios of 1 to 500 in terms of clinician to student ratios. So solving for it would take a all hands on deck approach, and JED has known that for decades. So when we come on these college campuses, we make sure that we create a task force that not only includes the key stakeholders within the counseling centers, but also includes folks from the president's cabinet, the board of regents, faculty members, student representatives, so that everyone has a role to play within the governing bodies on their campus to move the needle along. And what we found is that stigma, which is the big elephant in the room when it comes to mental health, had done a number on our college campuses. And to really understand why, we have to look at the history of just psychological services in general within our nation, and even assessment. If we go back just a few short years, 50 plus short years, what assessment was really meant to do once introduced to folks in society, it was to essentially do 2 things. Discover if you were healthy enough to go to work or war, and if you were neither, you could be institutionalized for things like depression, anxiety, bipolar 1, all of which we find on our college campuses as the 3 top diagnoses of our students that are traditional college age. So now we're moving away from that by letting folks know that, listen, if you have those challenges, you're not alone. There are resources for that, and there is care to be had on our college campuses. And so we are so proud that there's work to be done, and there's ways that we can definitely move the needle on how students are experiencing their mental health on our college campuses.
Thank you very much. The count is not 9 now, moving the needle. So I don't know why I'm keeping track of that. I'm an engineer. I love numbers. So let's talk about policies. What are the policies that are barriers in seeing us scaling the work to support student healthcare, mental healthcare? Anyone? All of you?
I'm happy to pick it up where I dropped it off.
Thank you.
So for a lot of this work that we're doing right now, we're literally building as we climb. All right, we have not had this moment before. I can't say that enough, because I've been in conversations where folks want the program, the implementation, and the outcomes within a week, so that we can scale it and put a policy up for each state seamlessly. But when it comes to policy, I think what's really important, and a few of us have already talked about it, definitely our first brilliant panel touched on it here, is that because we're not doing this work in a vacuum, we're doing this work parallel to other policies that directly affront the way we equitably look at our humanity. I cannot harp enough about the importance of culturally responsive care, about believing and listening to minoritized communities, and centering the needs of those that are least centered across a couple of different areas. And when we're currently in a landscape where things like equity and inclusion are being limited or completely struck down or overinterpreted on our college campuses, by which we're not able to continue to do that work because we don't want to disaggregate by things like race, it's really challenging sometimes. It creates a very clear barrier to getting students to have access. And whether we know it or not, and I think our earlier brilliant student on the first panel had mentioned, students feel that. They can sense when their issues are being pushed to the corner or pulled aside, or when their communities are being kind of packed up and shipped out. And those are all policy issues. And we have to get back to where policy centers the needs of the people and not the needs of the politics of the day. And the data tells us that we don't have the luxury of deciding or grappling with whether or not we center people and the needs of youth on our college campuses and actually across the K-20 spectrum. So that's the one that I definitely want to make sure that we highlight.
Well, thank you. Others, any?
We haven't talked about social media yet, and there's a rise in anti-social media legislation. And personal thoughts are that social media is likely a contributing factor to the mental health issues that we see among youth and adults, but again, not the only challenge. And there seems to be just a lot of zealousness over tapping down on social media. One thing we have to realize is that there's a lot of nuance and differences between social media platforms. And so even grouping these together as one force is likely a red flag. And we need to be aware that students are using social media to connect with each other. They're using social media to get validation from each other. There's a lot of pros with social media as well. So we're not pro or anti social media. We see benefits and losses from both opportunities to regulate social media. One thing I wanted to highlight that we're really excited about is there also seems to be a lot of energy around peer support and peer-based programs in legislation. And we know that students are more likely to go to a friend when they're struggling with their mental health. And so we do want to make sure that students have spaces to connect with peers around their lived experiences. One thing that we've learned at Active Minds from our students, many of our students are very, very passionate about mental health. They've done all the typical gatekeeper trainings that are out there. They shared that when they're on the spot with a student, they're not necessarily aware that a student's having a quote unquote mental health issue. A student's just experiencing an everyday challenge, much like what was shared about your podcast. And they wanted to know how to support their friends who are in need and felt like they were afraid that they would say the wrong thing, or they were afraid that they didn't have enough training to be able to do it. And I think unintentionally we have painted this picture that you do have to go through this rigorous training before you should ever think about having a mental health conversation, when really to our students a mental health conversation can look like, I don't know where to go for a job and I'm worried about that. I don't have a sense of purpose in my life. So we partnered with MTV to elevate, again, an idea that came from young adults. It was a simple 3-step tool for how to provide empathy to your peers. And we rebranded it together as Ask, Acknowledge, Support, Keep in Touch. And over the fall, we were on tour with the US Surgeon General to give students on 9 college campuses immediate steps for how to learn empathy in 5 minutes or less. And we know that many of those students will go on to take those trainings. And the more training you have, the better you are at providing peer support. But we also want all students to have those basic knowledge and skills about how to provide empathy, because we know from our research that's really what youth and young adults are looking for. They're just like all human beings. They want to be heard and valued, and that's mental health as well. And so we're excited to see peer support finally being embraced. We're excited to see more funding to compensate youth who are becoming peer supporters. And we also want to complement all of those formal systems of peer support with more actionable steps that all youth and young adults can learn about, take steps towards, so that we have a full campus community of peers supporting one another and feeling like they do have what they need to support each other and they don't have to be experts to help.
To add on to the social media part, I do think that there are pros and cons to social media, of course, but I think the main thing is how you're interacting with social media. A large part of it is algorithms, of course. So if you're going out of your way to look for things that are going to make you feel bad, whether you realize it or not, you're looking at influencers, or from a Gen Z perspective, you're looking at influencers going on trips. They're going to Coachella weekend 1 and 2, and they have VIP and artists and whatever it may be that makes you feel not the best about yourself. You're going to keep receiving that same type of content. And so I think it's also realizing you need to recognize the science behind social media and realize if you want to see things that are empowering and uplifting, you can, and you will, and you'll be fed that. But I think a lot of people don't really understand that. And so once they get sucked into the content world, that's what they're stuck to, and they don't necessarily know how to get out of that. And touching on focusing on like BIPOC communities, I think it's also hard to have this conversation of how to help the mental health crisis on college campuses when the foundation is already rocky to begin with. You can have a perfect utopia on a college campus. You have the best mental health resources, in there, and the students are amazing, but you are going to leave campus at the end of the day. Come 5 o'clock, you're going to have to go home and you're going to have to go into the real world. And so I think we also need to be talking about, college as a part of it, but how do we fix these problems as a whole? And I think that'll greatly scale down the issues that students are facing in general. I mean, I think we're also talking about financial mobility and financial literacy. A lot of students, specifically first gen, they don't have access to these resources. They don't know how to get a credit card. They don't know how to build their credit, or et cetera, how to take out a loan. And so it's a lot of these outside factors that are contributing to the college experience as a whole, but these things are often overlooked, and we're taking the aspect of college students in general, but we really, as was stated, need to focus on those students that are marginalized.
Well, thank you. A great point. From your work, what are the emerging challenges that we haven't spoken about that are on your radar, that we should be on our radar as well, looking forward to the future?
I guess this is probably on everybody's radar and has been for a long time, but I don't think we've touched on it too much today, and that's workforce challenges, right? They have always been an issue, and they're becoming more and more of an issue, especially as more folks are realizing that, they can have access to care and can seek care. And so making sure that we have the workforce to meet that. And I think one of the things I would say, and this isn't sort of a flashy answer at all, but this is a long-term ongoing investment that you just have to, keep working at. So for example, WICHE's been around for about 70 years, and we have a behavioral health program that has been around for almost that long. And they've been working with our rural Western states to help make sure that there are psychology internship locations for doctoral programs in really rural, remote locations. And so that then those folks will then stay there and be able to provide those services to those communities. And it's small, right? It's a handful of folks, maybe it's 5 in certain states, but it's every year going on. And so now there have been over 300, graduates over time, many of whom are staying in those communities. And so I think creating place-based opportunities as we're building workforce pipelines is really, really critical. And then the other part I would add to that, I think this actually ties into the conversation about peer support, and what Laura mentioned about making sure they're appropriately compensated and also appropriately trained at a certain level. If they're providing Medicaid reimbursable services, that they have, the training to do that. And so I think states have a really critical role to play there as well, and to build that, and ideally in a stackable credential framework so that there's opportunities to move up. But again, also making sure it's really place located is something we found is really critical.
Great.
I can add to that on the topic of workforce development. We're also watching workforce shortages in clinical behavioral health. One of the things that we're really excited about that we think we're uniquely positioned to do is we have so many youth and young adults who are passionate about mental health. Some of them want to become clinicians, but others want to go into multiple other fields. And we know if we're trying to take a public health approach to mental health, we need mental health champions in every sector and every industry. And so we're now looking at how we can connect our youth and young adults with our alumni who've been successful with taking mental health advocacy in their careers, so that if our youth and young adults want to become law enforcement officers, if they want to become teachers, whatever it is, that they know they don't have to leave their mental health advocacy at the door. They can be part of the mental health workforce, even if they don't want to become clinicians. And that's something that we're super, super excited about. The other issue that we're tracking on is faculty well-being, and excited to have heard that at the initial panel as well. If we're applying a traditional mental health approach to faculty well-being, we think about we need all faculty to learn basic mental health 101 training. If we take this new generation's approach to mental health, we think about, yes, they need that training and support, but we also need to pay our faculty well. We also, 50% of faculty are adjunct or part-time. They're not even fully embedded into the campus community. And again, if we truly want to move the needle, we have to, as a mental health community, start talking about these issues. And it's helpful when we frame these issues as mental health issues, because mental health is on the minds of our college university leadership, and we should leverage that while we have it and make sure that we can be actually effective. And when they are fully paid, when they are fully embedded, when they are fully supported, then we also need to provide them training so that they can provide that support to our students. We know that that's really important to our students as well. It's impacting their everyday and their mental health and well-being. So that becomes a priority for us as well.
Thank you.
I have two to add, just kind of building on the workforce piece. I'm thinking again, going back to the before times in 2020, one of the ways in which we were able to meet the need of mental health challenges across the nation were that there were states that were able to practice across state lines. It was known as a PSI-PACT led by APA and the visionaries there that said, listen, we're all quarantined. There are folks within rural areas that desperately need support and help, and we're not going to build out enough of a workforce while we're quarantined to meet the need. And so that allowed for several states to allow folks to be seen by clinicians. And so one of the barriers that I think this really addressed, although that was just a response to the current emergency, was continuity of care. What would happen if youth that, it's particularly out of state youth, I'm just thinking about traditional college age students, had a way of sticking with their doctors, especially if they already have a battery or they already have a 501, I'm talking therapy talk now, they already have a portfolio of care from the states that they're coming from. How well would they thrive within their college campuses if they're able to legally stick with the same folks? And this seems obvious, but because there's so many layers, as Christina had mentioned earlier, so many layers of policy and impact and key stakeholders to really get through for us to build out the foundation of what our system really needs. This is a continued conversation. And this leads me to my second way that we've been addressing this. JED has partnered with our fantastic colleagues through the SHIO organization, the State Higher Education Executive Officers Association, to build out a mental health learning collaborative. And in this collaborative, we are partnering currently with 5 states, Arizona, Louisiana, Oregon, Texas, and Pennsylvania, to work with their higher education post-secondary leaders to figure out, first of all, what do we do with these new laborious budgets that we have towards mental health? Where do we see those investments to be most effective in bringing resources and supports to scale? And then how do we go about sustaining that? And I can almost brag about every single state and how they've centered their work. Some have, partnered with online resources to ensure that there's scalable online services available to students no matter what. Others have focused on building out community-based partnerships and triaging on and off campus, so you're never turning a student away, especially students that are in crisis. But what's consistent right now as a barrier, again, goes back to consistently thinking about higher level policies that will allow this work to sustain itself even after this cohort of practitioners and students leave our college campus. So when we think about education, what's interesting is that particularly for our college campuses, they're not fixed. We blink and within 5 years, we have a new cohort, most of the time of students, hopefully, and oftentimes of faculty. And so we don't want to have to reinvent the wheel around this work. And what we're hoping emerges from that partnership is just a standard foundation framework at the state level that meets the need and answers the questions around who needs to be at the table, where should we first target our investments if our states are just having these conversations, and what types of policies need to exist and be put in place for the mental health of our youth to be centered at all times, no matter who's at the table at the time.
To add on to that, I think a lot of the times when we think about mental health, our minds immediately go to counseling or therapy or psychiatric help. But I found that a lot of the times peer-to-peer interaction can often bypass that. That's the step before the counseling or the therapy. And I think it's just because people feel lonely and they feel that they can't share their feelings, that the next step after that is therapy. But when you give people the space to share their emotions and to talk about their feelings, oftentimes they feel that they don't need that next step just because they know that somebody has acknowledged them. Even if somebody may not be able to fully relate, as long as they know that their story is shared and heard, that's enough for the majority of people. But really, if you see a meeting advertising like come and share your feelings, I think only brave people would go to that meeting. And so I think when you phrase it and disguise it under the sense of, come to this meeting and we'll talk about our favorite songs and we'll talk about a song that made you feel this certain way. That's what we did with Astro last summer. We held an event where we advertised, come to this space. We're going to share a song that brings us a happy memory, whatever memory may be, really. And we had a small group of about 10 people, and we all shared our music and we all laughed, got a little bit emotional, of course. And we found that by the end of that, these strangers that I didn't know, now I have their Instagram and now I'll message them occasionally. And so a lot of the times it doesn't have to be, I'm like trauma dumping onto this other person, or I'm telling my counselor like my, deepest, darkest secrets. A lot of times it's just, I had a hard week this week, and rather than it snowballing into now I hate my life, it's just going to be a conversation of, this week things just did not go well. But once I share that, I recognize it's really not that bad. And the next week will come and better will come.
Great. Well, thank you very much. Now, in the audience here and online, we have a number of university administrators, we have researchers, organizations, association heads here, and including trustees. So looking forward, where do you want this conversation to go? What advice do you have for folks that are sitting here or listening to us, or the Department of Education going forward? So this is your chance.
Well, this is not actually advice, but something I would say I'm excited for. I think there has been so much, and this was reflected, I think, in the earlier panel, momentum around K-12 and the work that they're doing to really integrate and, make it the school a hub for all the resources that a student needs. And I think higher education has a lot to learn from that. I do think it's going to be really different, again, depending on the institution type and the state they're in, how their agencies are set up. And so that will require a lot of adapting to context. But I think there is so much to learn from the work that's occurring right now in K-12. And so I'm kind of excited to see that moving forward.
I think I will add just the power of intergenerational partnership. The students need us and we need students. We don't know what all the barriers are. We need to hear from them about what it's like every day so that we can get to those barriers, and what we create is strategic given the limited resources that we have. And so really seeing it as an opportunity to work directly with students as partners and not just as support receivers, and making sure that as these policies are being made, that we do have students at the table, that we do have student-informed data to help guide our decisions. It's not just the right thing to do, it is the most strategic thing to do. And let's make sure that students who are typically left out of those conversations are centered in what we're creating and the policies that we're making, so that we can make sure we're not causing any harm, and also that we are releasing some of the innovation that we haven't yet heard, that we haven't had tried, that many, many students across the country could benefit from.
I'm excited about a lot of things. So I'll echo everything that my colleagues here just shared. Centering student voice, especially when it comes to policy, is going to be important. I think what I love about this generation of student that we're serving in terms of traditional Gen Zers is that they're not quiet about what they need, and we just got to lend our ears to them and they'll tell us what they need. In terms of advice, I think it's really important that for those of us that are doing the work, those of us that are student facing, that we make sure that we center and focus on our own mental health as well. It is very important that you do not forget that you are not just an instrument of change, but that you are human too. And I've been honored to have so many private conversations with faculty, college presidents that have struggled and felt guilty about struggling. And that just shouldn't be. And that's just the remnants of some of the stigma that we talked about today, that we're kind of working out as a collective, as a nation, and actually the world, because believe it or not, this mental health crisis didn't just land here. The World Health Organization is having international conversations about data that really does unfortunately match what we're facing here in the States. And so make sure that you take the time to check in with yourself, to pause with yourself. I love when I'm talking to a lot of my older mentors about their sleep health, and they like laugh at me, oh, ha, 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 you older millennial and your sleep. Please center your sleep, please center your wellness, so that where you're pouring out from, the cup that you're pouring out from is just as full as what you're hoping to see in the students that you are serving and centering.
To add on to everything, I think a lot of the times it's easy to say, center young people, put young people at the forefront. I think I hear that just so often. But a lot of the times it's not reflected in the actions. I think it's, of course, put us and have our voices shared, but a lot of the times, have us in the audience too. Some people don't want to speak, but they do want to listen and they want to share with other people. They just don't want the microphone in their hands. And that's completely okay. I think a lot of times people are scared of Gen Z in a way. Adults will empower us and uplift us and tell us, you can do anything you want, and et cetera, et cetera. But once we finally reach that stage of self-confidence and we are formulating our own opinions and we're putting those opinions into action, it's shut down. So a lot of times it's very hypocritical in a lot of ways that I see. So I think just making sure that everybody is included, panelist or not, and having young people in the audience and having young people at the forefront of these policy changes, having their opinions and actually talking to them and listening. A lot of times, I think having the conversations with young people is seen as just data that you're collecting, you're hitting a check mark, but these are real stories with real people, and it's not just one person, it's thousands and millions. And so I think just most of all, just listen and be prepared to have an open mind.
Well, thank you. My last question is, what is that question that I did not ask you? What is your final words that you want to add to the discussion? Not all of you at once. Laura, thank you for bringing up the faculty and staff as well, because most of the time we really focus on students, but it's the entire community there. Any other area that you want to make a statement?
I think I'll add one more thing. Just the power of peer-to-peer. We know that when peers are equipped with what they need to support each other, to even advance knowledge regarding what exists on campus. That's what Active Minds has been working on over the last 20 years. When our organization first started, nobody knew on their campus where the counseling center was. And there was usually one or two counseling center staff members there who were even then kind of overwhelmed by demand, didn't have the capacity to go out and do outreach. And that was the power of peers. And I think that same concept could be applied to other populations as well. We think about faculty, what would be the power of peers there? We know that it can change knowledge, attitudes, behaviors, even in a single year. And so that's one piece that I would highlight.
Yeah, and I would maybe just, I think building on that, it's peer-to-peer institutions as well, states as well. There's, I think, as Zainab has said, we're sort of at this special moment and there's so much ahead of us, but it's really going to require working together. And we so appreciate, the department for bringing everybody together today. And I think, continuing to provide those opportunities is going to be really important, in particular, integrating with healthcare as well, which I think is complicated to do, but critically important in this being sustainable. And so just continuing to learn from one another as we're really trying to address this very multifaceted challenge.
I'll add that we didn't talk too much on this panel, although my breakout did, about school-based Medicaid, and it being one of the many tools that we can use to just scale opportunities for access and resource allocation across the pipeline. And the other thing that I'll mention is when we think about using student voice, making sure that we attribute solutions to our youth, one of the ways that JED is going to be working on this is we're launching a youth advocacy corps in partnership with other organizations that are in this room, where we want to make sure that with any of the policies that we endorse or create, that student voice is at the center of that work. And we're really excited because youth are ready to tell us and they're ready to lean into that work. And I think that's a phenomenal opportunity.
To add on, I think also a lot of times people look at Gen Z and they're really confused and they're asking all these questions, really trying to figure us out. And really all it takes is just listening, as we said before. Just imagine how you felt when you were a teenager and you didn't know what you were doing. You were failing your classes or you failed a quiz, and how you felt in that moment is how we're feeling now. Now it's just the circumstances are different, and it's learning how to navigate those circumstances and how to work with what is happening now in the real world. And also how you mentioned previously, you can't help others unless you help yourself. And so if you are in this line of work, you need to make sure that you yourself are okay, that you're in touch with your own feelings, because a lot of times, if you're not, that is projected into your work and it shows a lot of the time. And so I think just take care of yourself and take care of others.
Well, thank you very much. I want to thank all of our panelists for a rich discussion that we've had here. Please join me in thanking them. And thank you all for your engagement. Thank you.
Are they bringing it over here?
Yep, he's going to bring it right there, and they're going to take this chair off.
All right.
We've got the
Great.
set up, and you can have it.
Thanks. All right, good afternoon. This has been amazing. I'm walking away feeling my heart full, my mind full, my spirit full. I want to start with gratitude and just thank you to the Department of Education for reaching out to the Office of the Vice President to say a few things. I'm very sorry she can't be here. I know she is as well. This is absolutely her jam. But it's mine too. So I'm excited that I was able to step in. I want to thank you all. Thank you to all of the participants today. So much insight, knowledge, personal lived experiences. I really appreciated hearing everything everybody had to say. I'm very excited to bring it back, put it to action, consider it as we figure out what we're doing within the Office of the Vice President and the White House. I want to say thank you especially to the students online and here. Kay, Kayla, there were fewer of you than I thought there might be, but you had extremely powerful things to say, and I look forward to future conversations. Again, I think you inspire the Vice President to speak honestly about youth mental health, the youth mental health crisis, and to really do everything that we can do to address that. My comments are really geared more toward students than they are everybody else in this room, but I think we all share a passion for that population as providers, as people working in nonprofits, as policymakers, as parents. I know I'm speaking not only to Kay and Kayla and other students here, but also my daughter, who's 19 at the University of Vermont. Her friends who actually were kind enough to sit and listen to me deliver these remarks to them this morning and sort of test them out, tell me where I was not hitting the mark at all, happily. I just want to say this generation has the courage to talk about so many things that previous generations have not. One of those is mental health. It's shocking to me how comfortable many young people are talking about mental health, maybe not in those words. But I think that's something really impressive and very courageous. And I'm not saying that it's easy for everybody, because of course it's not.
And there are so many issues that cause trauma for young people today. There are attacks on our rights, on our reproductive freedoms. There is gun violence, there is climate anxiety, there is poverty. There's many challenges that really have a trauma impact on people. And the result of that really has been this mental health crisis. Lots of factors that I'm sure we're only beginning to understand. But I just want to say, we know the symptoms, right? I mean, young people know the symptoms. You can't get out of bed, you can't sleep, you have panic attacks, you're feeling anxiety. And the consequence of no treatment is significant. There's anger, there's withdrawal. It has a pretty profound impact on your life. And in the most extreme circumstances, there is self-harm, suicide, or other sorts of violence. Shouldn't have to endure this. We have a duty to address the crisis as a country. I think we've talked a lot today. I've heard a lot today about resources that are available, the things policy makers are doing, the funding that has been made available, including things like the Bipartisan Safer Communities Act, really the largest investment in student mental health in history. And I realize that much of that was invested in K through 12 schools, but I think is still important to raise here. There's loan forgiveness, which I think is an important part of the equation for many students. Certainly there's the 988 suicide and crisis hotline. It's such a resource, and I keep talking about it. I think it's so important that we raise that and make it available to everybody 24/7 in all sorts of contexts, especially on college campuses. I hear you saying that websites aren't going to cut it. That information needs to be made available in ways that are much more accessible and realistic than websites alone. So there's a lot more work to do, and it doesn't have to be this way. That's something that you'll hear the Vice President say. That's one of her refrains. So much more work to do. It doesn't have to be this way. We need to keep on working. So the current young generation in college makes the Vice President optimistic. This is something else she talks about a lot. There is incredible ambition, a great deal of aspiration. And whatever your dreams, she would say, she wants to help you achieve it. So she's counting on you to have the courage to act. And if here, she would also say, I think, take challenge and turn it into purpose. On her Fight for Our Freedoms college tour, she challenged college students to take up the cause and consider pursuing a career in mental health, to look at those mental health professions, to take the experiences they've had, their trauma, and just their lived experiences, take charge and consider a profession in mental health. So there's so many ways you can do that. We've heard some of those today. I think certified peer mentorship generally, even when it's not certified. There's so much potential there, students supporting one another. I think that's one of the primary ways, and we've heard that. I know the Vice President's heard that. I've heard that as well, talking to young people while I've had the opportunity to work for her. You know, other ways are to be a school therapist, a school counselor, to even go on to get a medical degree, to be a psychiatrist. So many opportunities here, but part of it is putting the supports into place to make those opportunities achievable for young people, to not only grow the workforce by drawing on the young people across the country, but also to diversify that workforce and make sure that we are engaging people that look all sorts of ways, that live all sorts of ways. I guess I will just wrap by saying, remember your power. Again, trying to channel somebody who is an incredibly impressive woman, and I can't really quite do that, but I want to say, remember your power. You have the power to impact the mental health crisis. Everybody in this room, so many of you, this is what you do for your career. Others, maybe this is something you will do in your career in the future. There's just so much potential here. You can do it in your personal interactions. You can do it as your profession. I just wish you all the best. It's a pleasure to be here. And I know that the Vice President And I also know you are capable of so many things. You will do so many things. And thank you for the opportunity to be here.